Hello, welcome to this AIM webinar, Unveiling the Power of UDI, Enhancing Hospital Operations, Patient Safety, and Financial Performance. Before we get started, there are a few housekeeping notes I'll be going over. First, it's the policy of AIM to conduct its operations in strict compliance with the antitrust laws. No AIM activity shall create even the appearance of a violation of the letter or spirit of the antitrust laws. And next is our collaboration and work product policy, and that states that committee meetings or webinars like today's are held for the primary purpose of advancements in our industry, which necessarily involves development of work product intended solely for the public domain. AIM's developed this policy for the protection of its members who engage in this important collaborative effort. And some additional housekeeping notes: today's webinar is being recorded. As a registrant, you will be notified when the recording is available. We also will have a brief Q&A at the conclusion of the presentation. To take part in this, please submit questions via the Q&A option at the bottom of the application screen. And it's my pleasure to introduce to you our speakers for today. Lana Mechanic, the COO and co-founder of ViewMed, a healthcare IT company that solves inventory management, supply chain, and product usage documentation problems in hospitals using UDI compliant RAIN, RFID, and barcode scanning technologies. Lana works with clinical, financial, and supply chain leaders in hospitals and is a subject matter expert on data-driven clinical inventory optimization, supply chain visibility and predictability, clinical documentation at the point of care, AIDC solutions, and more. Christina Crow is the AVP of Network Supply Chain Operations for Westchester Medical Center Health Network. Christina's expertise is in increasing productivity and reducing costs through strategic supply chain planning, lean process improvement methodologies to improve purchasing, inventory management, increased utilization of data, and technology maximization. Thank you two for being here. And Lana, why don't you kick things off by going over the agenda for today's session?
Great. Thank you so much, Mike. And good morning, good afternoon, everybody, wherever you may be. Thank you for joining us today. So what I'd like to go over with you, I'll go over the agenda. Christina and I will go a little bit of back and forth throughout this presentation. What we want to cover today is a little bit about medical device industry, what UDI is, what is meaningful about it within the med device side. I know some of you may be familiar with the pharmaceutical DSCSA regulations and track and tracing requirements on the pharma side. This is going to be, we're going to be talking about primarily and exclusively on a medical device side of the industry. We'll talk about various hospital challenges in terms of handling UDI type of information and why those challenges warrant solutions around UDI capture and dissemination, and what those solutions are, what their benefits are, and what kinds of results could be achieved by being able to deploy those solutions, being able to capture and UDI information and manage inventory accordingly. So in terms of med device industry, for those of you who may know, and quite extensive industry, it's globally around $400 billion a year. It's about roughly a third of what pharma industry is globally. And the issue with med devices is that in terms of managing and tracking, tracing of these kinds of supplies, and we're talking about consumable, expiring type inventories, right? Consumable types of devices. We're not talking about medical equipment like MRI machines or something like that. We're talking about consumable medical devices. These types of devices are used for many different kinds of procedures and many different kinds of patients. There's millions of them out there. They are an absolutely necessary components of patient care processes for many patients in many different clinical settings. And the issue with those devices, of course, they have to be managed and controlled and purchased in accordance to usage. But a lot of that work, a lot of those processes are not very optimized in many healthcare organizations. And as a result, you've got things like inventory bloated inventories, excess purchases, waste levels are quite high. And on the financial side, these devices are often also subject to being charged for and part of the revenue capture processes for most hospitals. And that part is often missing as well, as a result of sort of poor visibility and tracking and tracing of these devices. So partly for those reasons, meaning to enable tracking and tracing, and partly to solve, obviously, patient safety concerns. As you can imagine, if you can't track and trace something, and you also have some potential patient implications in terms of safety of these devices and managing them. So FDA, as you guys know, instituted the UDI legislation a number of years ago to be able to start effectively tracking and tracing medical devices from their point of origin all the way to the patient, right? And as part of that regulation, there's obviously a requirement to put an IADC type of label on each of the med device packaging, and to ensure that that information also resides in the FDA mandated Good ID database, meaning it's a publicly accessible database of these devices with this AIDC information recorded. So everybody should know what a market identity of the item is, and FDA knows about this item, and manufacturers need to submit that information. And that information is also on each product package, so it can be tracked and traced throughout its life cycle. All right. One of the things that I wanted to mention, and Christina is going to talk more about it, is the patient safety implications of this are pretty significant. Just to bring it home for us, I'll give you an example of, I remember receiving a recall notice from Costco for buying a bag of lettuce, right? On the other hand, my father-in-law, who received a pacemaker and a defibrillator combo device, only found out that a component of his device was actually recalled when he started feeling something off and went for a checkup. Right, so it gives you an idea of where we are in this industry around being able to manage just basic things like recalls when it comes to med device supplies. So that's the kind of problem we absolutely need to resolve as an industry, and that's what we're working towards. All right, so besides, obviously, patient safety implications, there are significant workflow operational implications of having and managing UDI throughout a healthcare continuum, and particularly from the supply chain perspective. I mean, this I know it's a busy slide, but this is to give you an idea that having the identity of the supply device you're using has significant implications throughout the entire process. And not only does it have significant implications for supply chain directly, meaning how you buy the item, how you manage it, how you bill for it, and then pay for it, but it has significant implications for the clinical workflow, to be able to capture the right item you're using, to be able to make sure that item is part of the clinical record and patient record. And then it certainly is a huge part of the financial workflow of each organization, right? Because you need to make sure that you're purchasing or reordering the correct item, and that you are paying for the correct item at the correct price, and so on and so forth. So not to mention, of course, the revenue implications, as I mentioned before, in terms of the items that can be charged for. In all of these workflows and all of these processes, the supply chain, the UDI data is a critical component, right? You need to be able to track and trace each item throughout each of these processes, and you need to make sure that it sits appropriately within each relevant hospital system for all kinds of purposes. And today, the many organizations, unfortunately, don't have that information flowing smoothly, if you will, between different systems. And oftentimes there's this gap between how the information, the data is managed in hospital ERP systems, right? The systems that are responsible for purchasing, contracting, and so on and so forth. and how this information is captured and managed in the actual clinical systems. It's not, when you're documenting, to again bring it home to this, or not familiar with the devices, you may go to a store and buy, I don't know, a Gala apple, right? And in your receipt, what you might see is produce purchase, right? Something very generic, right? So this is the sort of thing we're talking about in many of the healthcare facilities. You may not have a direct correlation between how things are managed in one system versus how you see it in another. And then a lot of the times you have this data gap in terms of not actually knowing what you have on hand today, or what might be expiring the next day or the next week. Are things safe to use, and so on and so forth. So that data gap is important to resolve, right, in order for us to make an impact here. And that data gap, again, is exacerbated a little further, again, as I mentioned before, because you have a complex healthcare environment. You have multiple systems that are in play, each of which are managed by different parts of the organization, oftentimes different constituents involved. But all of these systems require UDI data, for instance, item level data is really required to be able to not only to track and trace it for certain patient safety purposes, but for all of those other purposes we talked about, financial, clinical workflows, decision support, supply chain activities, right? And today, again, a lot of oftentimes that data may not flow at all between different systems, or it's not flowing against the same identifier effectively for any given item. All right. So I'm not going to go into the details of the slide. You're welcome to ask questions around if you have any specific questions around any of this, to talk more about it. But the main point is that there's current complexity, and we want to make sure we solve this complexity by ensuring the UDI capture and dissemination of the data across all relevant systems. All right, I'll pass this to Christina. Christina will talk more about her experiences as healthcare supply chain leader. Go ahead, Christina.
Thank you. Again, my name is Christina Crow. I am the AVP of Supply Chain Operations, which includes distribution of supplies, purchasing of supplies, and then the management of all data, which, as you'll see throughout what we talk about, that it can be quite impactful. So Westchester Medical Center Health is one of 9 hospitals in the network. We are headquartered in Valhalla, New York, which is right outside of New York City. Hospitals are often thought of by staff bed count. So our staff bed count is 1,700 beds. We have a level 1 adult and pediatric trauma center. And so we staff the supply rooms for those trauma centers 24 hours a day, 7 days a week. As the region's only perinatal level 4 NICU, we have a high acuity of neonatal babies quite often. And we have the New York Medical College is on our campus, so we are considered an academic medical center. We have 3 different ERPs, and we have 2 electronic medical records that we work with. And so having 3 different ERPs, it can be really impactful, because that means that we have 3 different item masters. So by nature of the kind of care we provide via the trauma center and the NICU, we commonly have high acuity patients. And as you know, the onset of COVID exacerbated us, Westchester Medical Center, but also the nation, the world. New York State actually set the 90-day PPE requirements around Westchester County's COVID patients. So the increased challenges of caring for patients has resulted in nurse and provider fatigue. And with that, there are staffing shortages for nurses and providers. And this isn't just something that we experience in our network, it's across the nation. As such, we often have to rely on agency staff to offset the staffing shortages that we have, which impacts our ability to, it impacts cash flow. So given the increased demand in hospitals, coupled with the global constraints of supply chain, it has been increasingly important for leaders like myself to leverage third-party vendors so that we don't negate the ability to care for our patients. Okay, so as I said before, we have 3 different item masters, and it's often a challenge to keep the item masters accurate. The item master should be the source of truth because it does have a negative impact. If it's not maintained properly, it does have a negative impact on purchasing. It has a negative impact on financials. It has a negative impact on data analytics, but ultimately it has an impact on the safety of our patients. So utilization of inventory management systems that capture the unique product identification decreases the likelihood of delays in providing care to our patients. If we don't have the right product here at the right time the first time, it could be significant to somebody's family. So in addition to the facts that you see on the screen, I wanted to just raise the point that surgical cases can be significantly delayed or canceled. And the likelihood that happens is high probability related to the lack of supplies. And as an example, I explain to my new employees every time that they come that the impact of supply chain, it has a direct impact on patient care. Stockouts, credit holds, back orders, rejected orders, all impact our physicians' ability to provide care to the patients. We do have a level 1 trauma center, and we are in the level 4 NICU. So we do have some very critical life-threatening injuries, and the surgeons who are taking care of these patients, if they don't have what they need, it could result in loss of life. So the need for resourcing, right? So how many days on hand do I have? That's really important. So if I have a back order or something, and we track back orders regularly, if I have a back order of supply, the first thing I always ask is how many days of supply do we have on hand? Because that's how we determine what's more critical versus what's not. Oftentimes we get put on allocation. So whether it be sutures or Band-Aids or cups or implants, just because you place an order doesn't mean you get it. And so managing allocation of products, oftentimes I have to look at how many days of supply do I have? Is it on back order? I have 9 hospitals in the network. Who has the more urgent critical need than others? Because sometimes that's what it comes down to. It's really important to have a solid relationship with your clinicians, and we strive to have a clinically integrated supply chain. So I rely on their expertise when there are stockouts, when there are back orders, to determine what can I bring in that they've used before, because I'm not the one that uses the products. I'm the one that has the team that gets them. And then, of course, if I'm asked to cut from purchasing to redirect dollars, which actually I do, I'm responsible for the med lab budget for all of the hospitals. I have to have good data. I have to have good information, because if I don't, then I'm not necessarily capturing cost in the right sub-accounts. I'm not, maybe I'm not providing enough support to one department over the other. And that can be impactful, right? So if you don't have the money to buy the supplies that you need because you didn't get budgeted appropriately, then you're at risk of not being able to provide care. And ultimately, the patient is the most important person that walks through the building. So how do I ensure that my supplies are safe to use? Well, this is where I leverage my third-party vendors. So like with ViewMed, having an inventory management system where I can scan into the inventory, and it gives me all of the data to include the expiration dates, et cetera, allows me to really understand what I have out there and actually where the supplies are. And then also what gets used in surgical cases. So I can look at what do I need to buy more of to support the upcoming cases, or what can I buy less of because they're not being used as much. And so how can I prevent that waste? What's going to be expired, et cetera. So all of that, I'm more easily able to get that information when I have a system that has a barcode scanner versus the item master that I typically have that does not have the ability for point of use and scanning inside. Back to Anna.
Thanks, Christina. I appreciate it. So yeah, no, thanks for those examples. And I'm just gonna elaborate a little bit more about what Christina was talking about in terms of the ability to have an inventory management system and ability to track and trace her supplies throughout each of the kind of relevant transactions, and to be able to have full visibility on what she has on hand, where it is has it expired, or when is it going to expire, and all of that. So ViewMed offers, we have a flagship ViewTrack application, which also has a RAIN RFID component. Some customers use just barcode scanning, some use RAIN RFID, or a hybrid between RAIN RFID and barcode scanning. But regardless of which of the data capture solutions are being used, they all sort of work in a similar fashion in terms of capturing the item identity, pedigree details, lot and expiration date, or serial numbers, and tracing them throughout their life cycle. So from the time they're added to wherever they're destined for, specific department, specific location, throughout the various supply chain transactions, and then ultimately all the way to what we call clinical use or depletion. Sometimes it's referred to as point of use. And making sure that information is, again, flows into sort of ViewMed Cloud, into our cloud application for reporting, analytics, and managing all the other critical components of the operations that Christina needs, like tell me what's expiring when, tell me when I need to reorder, being able to submit those transactions to the ERP system for getting those orders out, or identifying or helping identify which items she may not be able to receive because ultimately there may be back orders that her team needs to follow up on. Things along those lines. So that's kind of the goal of these types of solutions, and is to provide her organizations like Christina's with this full visibility. And so part of that visibility is also, of course, as I've been talking about all along, UDI data capture. So capturing that information, whether through barcode scanning or through RAIN RFID, tracking that information throughout the life cycle of the item within the facility, right, from the point of delivery through wherever they're stored, all the way to the point of care, and then ensuring that the data is disseminated, as I said, into both the hospital ERP systems, and even in Christina's case, there may be multiple ERP systems, more than one, in any given facility, right? Because facilities got, I think WMC Health grew through a number of acquisitions in the last 5 years or so, right? So they, her team has to deal with these additional complexities. It's hard enough with a single ERP system. Multiple ERP systems, it's even harder. And the same thing for multiple clinical documentation systems. And those clinical documentation systems, it's not just the EMR system, which we may be familiar with, but there's also there may be also specific clinical systems that are used in one particular clinical service line, right? So all of these complexities and nuances need to be managed, because ultimately that UDI data has to live in all of the right places, and starting with, and first and foremost, in the patient record. So that's what we make sure happens. So for those of you on the line who are, and I know many of you are work in this industry in terms of supporting all of these barcoding solutions, RFID solutions. So to give you a little bit more of an idea of how this works, so our solutions are work with existing manufacturer barcodes, as you can see in the picture, or with a RAIN RFID. Tags, and those tags may be printed with a human readable information or even a barcode as well on a tag. Either way, the same data is effectively captured. UDI is what is the item, what is the item identifier, what is the JITN, number of other pieces of information, and of course, what is the production identifiers, right? Whether it's a lot-based item, whether it's a serial-based item, and what's the expiration date. Those are the critical components that get captured. And then with the RFID solution, the way that we typically apply RFID is, as you know, RAIN RFID is excellent at tracking movement. So we take advantage of that when we put the RFID infrastructure in place at a hospital facility to where the items can be tracked as they move from supply room to procedure room, through the hallways, etc. And through potentially departmental boundaries, for instance, things like that. So that allows us to have an open type of environment, right? Doesn't need to be confined to specific cabinetry or anything like that, right? Working with existing supply storage environments and still being able to track what's in any given room or how things are moving from one room, one department to another. And so that's kind of that's of course, as you guys all know in this call, most likely what the advantage of RAIN RFID is. And that's how we typically apply it in the hospital environment, right? So, and you can see the infrastructure. You can see the pictures of antennas here in the ceiling, or sometimes we put it inside the cabinetry. That's the storage option there. But you can see that this is how we would typically outfit, if you will, the RFID infrastructure in a hospital facility, right? You can see examples: supply rooms, hallways, procedure rooms, things like that. And then probably one of the most critical components of the solution is really this centralized item data management, right? So we talked about UDI as a unique device identifier, capturing that information. So part of the whole solution is being able to identify DI, or device identifier, right? It has a universal identity. And here in the middle, you can see the VMED actually maintains a database of these universal item identifiers for the clinical service lines that we support. It's our cloud-based, we'll call it effectively universal item master. This type of approach allows us to make sure that any item that gets captured through any of our technologies, any of our data capture solutions, will always have a corresponding identity, correct market-based identity of the item, regardless of whether this item has ever been inputted into any given hospital's item master, for example, right? So our, we can capture and report and show information regardless of whether or not it lives in any customer's database, because for us, what's most important is to capture the truth, right? Here's the item, here's its identity, no matter what else happens. The rest of the process happens on the back end. So for example, you can see on the right-hand side, the associated data here. So we basically marry and maintain the market identity of the item with the hospital assigned identity to that item. That's your associated data, the hospital item numbers, their billing codes. This is how they would charge for items, for instance, unit of measure information, pricing, et cetera, that is specific to that institution, right? And there's a whole, various interfaces for that to manage that process and to manage that connectivity between the universal identifier and the hospital identifier. And then what that also allows us to do, as you can see on the left-hand side, is when any given transaction with that item is captured, we can then put all of that information into one place, right? So an item is captured in this location with this specific lot serial or tag ID, as the case may be. expiration date, right, for this particular transaction. All right, and so we know everything about the transaction, we know everything about the item, and we know everything about how hospital manages this item, right? All of those hospital-based identities. All of that comes together ultimately on our web reporting application, so that leaders like Christina and her team can look at the information, review it for what they need, run various reports, run analytics, and so on and so forth. And Christina, I'll pass it back to you to talk more about that.
Thank you. So on this slide, you will see a dashboard from UMed, and this dashboard would allow me to see that it allows me to easily ascertain the valuable information that I require to be able to make decisions. For instance, you'll see that it has an area where I can look to see what's expiring this month. So perhaps we would want to use those products first rather than ones that are expiring later. So that way we can reduce the waste. She was talking earlier about critical data and GTINs, and one thing that's really great about this product, but also just in general, is that if I need to find out what there are certain data characteristics that I need to have in the EMR or to have in our ERPs in order for it to cross over into the electronic medical record. And one of those, well, it's the manufacturer number, but also the GTIN. So we use point of use in the ORs and in all of our facilities. And in order for the items to scan into the item master, there are certain data points that need to be in the electronical or in the ERP so that it will flow, right? And there are times where it's not easy for me to get that information. And so I turn to my third-party vendors like Lana and ViewMed, and they can take my information and run it through their system, and they can then give me back some of those data points that I would need, like the GTIN and the correct manufacturer number. You'd also talked about like RFID and how hospitals use that. One real example that we have at WMC, it's at 2 of our facilities and about to be launched at 3 other facilities, is tissue tracking. And we use RFID for tissue tracking. So recently we had the Department of Health had come into our facility, the main campus. So the main campus is WMC proper, Westchester Medical Center. And this is also the Children's Hospital as well. So it impacted both of them. And they wanted to do a review of our patient records for tissue tracking. So you're supposed to have a fully auditable chain of custody for tissue. And how we do that is through the use of RFID tags. And we discovered that the Department of Health actually requires you to have the ability to research recalls on implanted tissue has to not live within the electronic medical record itself. You have to be able to get the information out of that, and we hadn't been doing that. So we had to rewrite all of our policies. We had to come up with a downtime procedure for maintaining the full chain of custody. So from the point of it arriving to the hospital at the loading dock through the point of implantation and then notification to the vendor that we use that product. And so we had to redesign or kind of like come up with our workflows, et cetera. But the use of RFID and then the ability to have accurate data in our item master, which also goes into the electronic medical record, allows the electronic medical record to feed into the system when the tissue gets used. So it's the same. It would be the same with Lana had mentioned her grandfather and the implant of a pacemaker. So UMed has got an amazing relationship with our cath labs throughout the network and our vascular interventional radiology departments as well. So if there is a recall on a pacemaker or any of its components, I would go to this dashboard that you see. I would pull up to the left side of the screen. You see there's searchable. I wish I could do a live demo for you, but there's some searchable components there. I can, outside of the electronic medical record, pull where that pacemaker was used, what patient it was used on, and then provide that information to the physicians or the clinicians, so that they can reach out to their patients and provide whatever next level of care is needed. And again, I say this over and over again, but I truly, truly believe it. Having the correct data in your item master is so impactful and crucial on everything. If you cannot, so if you have point of use, and regardless if you have point of use, if you're manually typing in information in the OR, if you can't capture that, the impact on revenue is going to be huge. Also, the impact on the FTE time that it takes to figure out what was used. We had to deal with that. We had an EMR migration well before my time. I don't know, maybe like 8 years ago, 9 years ago. And they had been struggling for so long because they couldn't use point of use. Nothing was scanning. And so they were manually entering everything in the EMR. But then you're missing a lot of important information. So the risk to the patient of a recall was high. The risk to the patient of maybe getting multiple charges that they weren't supposed to get was high. Undercharge, overcharge, wrong product in the chart. That chart has to be the source of truth. So every piece I use, that barcode is huge, and it has so much information in it that it allows me to provide the best level of customer service to my surgeons and my nurses and the other directors and VPs throughout the organization. So having trustworthy data, it just enables leaders to make sound decisions. Anything that you have in your perpetual inventory holds cash flow, right? And so if your data is wrong and your inventory shows that you have more than what you actually do, it impacts cash flow. If your data is wrong and you can't charge correctly, it impacts revenue. If your data is wrong and you don't know that, maybe your practices are not as skilled or as current as they should be, and your inventory accuracy is not there, your automatic purchase orders aren't going to know to drop, right? You want to be as automated as possible. You can't 100% be automated. That'll never happen, but not in healthcare. But 80 to 90% automation is what I would consider gold standard. And that means locked in processes and an item master that is accurate. I spent the last 2 years, I've been with Westchester Medical Center Health Network for 2 years now, and I've really spent the last 2 years focused on integrating 3 item masters into one and cleaning up the data so that the clinicians are getting what they need, when they need it, first time, right time, but also so that revenue cycle and patient accounts can close those claims, because really you should be doing it within 3 to 5 days. There are claims that were open for months because of the information in the EMR was not accurate. It was manually written, well, not written, typed. And they just couldn't figure out what the items were. So you can't charge for something that makes no sense. So the key achievements, as I said, automation. It is so important, and it means so much to me to be able to have the information at my fingertips to be able to scan and get it into the system versus having to manually receive something, having correct information so that we can make sound decisions as leaders, because every decision that we make as a leader in regards to supply chain 100% has an impact on our patients, even if it's that our PO was wrong, so it was, and they couldn't pay the invoices and we got put on credit hold. And I'll give you an example that I quite literally tell to every person that I interview for a position. And this will demonstrate the importance of accurate data. So a purchase order went out, and it was for a device that was going to be used in a surgical case. And it was supposed to be there for a Monday morning case. Friday afternoon, we were notified by the organization that we were on credit hold. So the buyer at the time, I guess, was a new buyer, left without making sure that the credit hold was released. So Monday morning, the product didn't show up. However, the patient, who was, I think, 11 years old, was brought to the hospital by ambulance, brought to the OR. Then the physicians found out they didn't have the product, had to then tell the parents that they were sorry they couldn't treat their child, send the child back by ambulance to then reschedule the procedure for another day after the product came. So credit holds are a direct result of improper data that goes out on purchase orders, and you can't pay your invoices, you can't match them, and you can't pay them. And so that is how it truly, truly, truly impacts a patient's safety and well-being. And then also, I think I've said it a few times that, and Lana has said it too, that improper data can significantly impact financials. I mean, just in that one case alone, where we were unable to pay the bill, we got it paid, but then also the loss of revenue, and the loss of patient satisfaction and quality of care. And some additional resources for you. I'm sure you all are very aware of some of these sites, but if not, you'll have them with the slide deck. And I think that is the end of our slide deck.
Exactly. Thank you, Christina. Thank you for all the examples. Those are always incredibly impactful.
Yep, thank you, Christina and Lana. So I'll go right into the Q&A section of our webinar. Lana, I know you typed out some answers already to a few of the questions that came in. A couple questions that we had come in that I'm just going to merge together right now because they kind of are on the same topic, and that's basically with RFID implementation in a hospital. Just from both of your perspective, how long does what's the process, I guess, basically like for RFID implementation in a hospital, how they implement it, and then more so, who's taught how to use these tools and how do you go about doing that?
Yeah, I can take this one. So in terms of RFID implementation, at least the way that we do it, it's basically we do an assessment of a facility or site, and that assessment includes not just sort of the physical layout of the space, obviously, and configuration, but really possibly more importantly is what is the actual workflow, both in terms of supply chain, how items are purchased, where they're delivered, how they get put away. We do a lot of recommendations around potentially where they should be stored versus where they are stored now, how they should be co-located, how do they move around the facility and all of that kind of stuff. How does it, what is the relationship between where supplies are, how do they interact with the clinical workflows, where do nurses need to go to get X, Y, and Z, and under what circumstances, right? Should it be residing in one central supply room? Should it be residing in each of the procedure rooms? All of those sorts of things. So based on that type of an assessment, we effectively provide recommendations on how to architect the RFID installation, right? Where to put antennas, readers, obviously depending on where the antennas are. And then we also work very closely with the staff to figure out what items they want to be able to track through RFID, because not everything is going to be tagged, right? Some things get tagged, some things get scanned using a manufacturer barcode. So that process is what we work through with the customers. Our applications are effectively, we think of them as the same. Well, ultimately, it's first of all, it's the same platform, but ultimately it's the same data, and it's the same reports we're surfacing to the user, regardless of how any given item is actually captured. or how any given item is actually managed, right? It's just the tagged items have an additional visibility, meaning you're able to do what we call continuous process tracking with those items, right? From point A to point B to point C, right? There's a full chain of custody. The items that are just scanned, you're only seeing those transactions at points in time, right? But ultimately, it's the same information. It's that we're capturing the JITN or an equivalent. It's not GS1 compliant. It's still the same data, but what is the item? What is the lot, serial expiration date? Obviously, if it's in the tagged item, what's the tag ID, and being able to track it throughout the facility. And then when it comes to point of care, Christina was talking a lot about, we want to be able to capture, because you have to have a specific event of capturing a particular item to the specific patient in that particular time and place. So that has to be a deliberate event. And that event is captured at the point of care through the barcode, through some sort of a scan. It could be a direct barcode scan. It could be a tag read, right? But it's specific to that patient at that moment in time in that particular procedure environment, that room. So then that record, once it's captured, then it's associated with that patient, and depending on the nature of the interface, that same data will go into the patient's EMR or EHR. So EMR stands for electronic medical record. EHR stands for electronic health record. I know, Chris, you asked that question. It's basically, people use those both of those interchangeably. Effectively, it's Epic and Cerner are good examples of EHR/EMR systems. It's the same thing. All right. Sometimes generally what people talk about EMR, EHR, it's sometimes they think of as a health record repository. So they do obviously serve as that. Health record repository means whatever happens to the patient, any part of the hospital, whether they got a radiology test or MRI or a specific procedure, right? All of those records from each of those encounters go into the EHR, and that's where they're stored, right? But sometimes any given patient encounter could be if the patient is undergoing a very specific procedure in a very specific place, that by itself may have its own clinical record and may even have its own clinical system, right? So whatever happens in that particular encounter also needs to get documented in that specific clinical system before it gets into the repository, right? So that's all of that, needs to be supported by making sure you capture the same item, same data. Needs to live in all the right places. So
can I just add to that? You had also asked in terms of time frame. Typically, a project like that would have a capital layout. So normally, healthcare organizations submit their request for capital the fiscal year prior. So what gets outlaid in fiscal year 2023 is normally submitted in 2022, right? So next year I would submit something for this year. There are times though that if there's a need for something more urgent, that it would be approved within the same year. So it really depends on if there's construction required, if it depends on some of the other outliers in regards to like if the facility is capable of having the RFID implementation without like construction or whatever. So that's also, so that really can drive the timeline.
Great. Another question we have is, how can healthcare organizations ensure the security and privacy of UDI data while implementing solutions for device visibility?
Security and privacy of UDI data, is that the question? Well, the security in my mind of UDI data is only specific to its association with a specific patient, right? So of course that's patient private information. It's a relationship between a patient identifiable data and that patient identifiable data would include whatever goes into that record, right? Including the use of any given device with its UDI data. UDI data by itself, meaning here's an item, here's when it was manufactured, here's its lot number, here's its market identity, because Good ID database is publicly available information, right? That by itself is not proprietary or confidential, right? It's only confidential when it is used for a specific patient in a specific time and place, right? And so from a perspective of a solution provider like ViewMed, what we manage, we don't actually deal at all with patient private information. We are submitting the use of the device or UDI data for a particular patient encounter, but that encounter doesn't have any meaning outside of the hospital information systems. Right. And so the hospital is the one that's responsible for managing and ensuring patient private information, whatever goes into that record. Right. Vendors like us, we don't actually transact on any kind of patient identifiable information at all. Hopefully that answered the question, right? Christina, I don't know if you have anything else to add.
Yes, so everything that we anything that gets implemented that has an IT component goes through like IT security. And of course, we have to be HIPAA compliant with everything that we do. So there's pretty stringent requirements. And so I don't necessarily work in IT, so I can't really like give you all of the details, but I know that it goes through quite a lengthy review process to ensure the safety of that patient information.
Great. So another question we have is, how are these processes like UDI or RFID implementation used with reusable medical devices? What percentages are actually tracked all the way to the point of care?
In terms of generally RFID implementations or any kind of implementation for device tracking, the reusable medical devices have their own identity, just like the originally manufactured device has its own identity, effectively. So at least that's certainly how we manage it, right? So each item has its own stock keeping unit number, if you will, right? And reusable a piece of equipment would have its own identity. And so if it's managed through RFID, as each item is tagged, as you know, it will have a unique tag ID component to it. So it will have a unique identity within the facility to be able to manage it. And it's also going to have a unique specific identity as a separate SKU in a database structure, at least within ViewMed system, it would have a separate SKU. So what you know about this item is, when it comes in, where it is, when it may be used for the patient, and because that it exists as a reusable device, then you know how many times it's been used if it's important for you to track that, right? So from that, for purposes of tracking it, it doesn't really matter whether it happens to be a reusable SKU or whether it happens to be an originally manufactured one. So I don't know if that's what you were after there.
So to add to what Lana was saying, we do use reprocessed reusable item. Well, I would say reprocessed, not necessarily reusable, but we do use some. And I think that the percentages, it varies from healthcare to healthcare location. Some hospitals are more inclined to do the reprocessed items versus other hospitals are not, or some service lines. And by that, I mean, a service line would be like GYN versus vascular, different service lines, different products. Some service lines may be more inclined, whereas some may not be so inclined. The only time that I've ever run into an issue in terms of being able to effectively scan at point of use for reprocessed or reused items, and is that if the OEM was the reprocessor, and essentially it's the same item from the OEM, and so then it comes down to we wouldn't necessarily be able to scan it, but all of the information we would be able to ascertain the information from the barcode, right? So it would be the same, but we would have to build a second item number, and that second item number would be tied to the unique information in the item master for that item. And so in that case, that time, it would have to be a manual lookup. And the only reason why I would say that is because the scan will be built to the OEM versus the reprocessed, and therefore reprocessed is much less. So you wouldn't want to charge a patient the original price. You would want to charge, if it is a marked up item, if it's a chargeable item, you would want to charge to the lower price. So in that case, you would have a second item. So
yeah, right. So yeah, each one has a separate identity. Yeah, right. OEM and reprocess have two separate identities, effectively. Yeah, exactly.
Great. And we'll end on this question. Not sure how much you would know about this, but from a worldwide perspective, how do you see these type of implementations going on in hospitals, if you're aware of that? Is it different across the globe, or is there certain areas where it's more, where you see more of this type of RFID or RTLS implementation?
It's an interesting question. I can tell you one thing, that these problems that Christina has described with a lot of examples, and from our perspective as well, they are unfortunately, or fortunately, depending how you look at it, they are the same. These issues exist globally, worldwide, across everywhere. So the main differences is really like sort of the payment models in different health systems. That's kind of the main differences. In terms of the actual tracking and tracing issues and potential patient implications, they are the same. In terms of whether or not hospitals are deploying solutions for these issues, and whether or not they have specific RTLS implementations for this, I think I don't know that there is a higher rate in any one part of the world than another in terms of how it's going. I think people are deploying whatever solutions either they can afford, or they can kind of embrace, or they can work with, right? So barcode scanning, I think, is here to stay with us. It has a lot of still opportunities for a lot of advancement and help a lot of these facilities. RFID absolutely has its place as well for a lot of organizations who really concerned about chain of custody issues, tracking and tracing, where they have a big organization where there's a scale potential for certain type of technologies, right, where it's cost effective for them to scale these kinds of solutions. So it really varies. I couldn't tell you, there's a specific rate of growth. Yep. That is not quite, I think the industry is still maturing in this regard. The one thing that is very clear is that it's more and more, as Christina mentioned, organizations of her size and larger, and as organizations get consolidated, these kinds of issues come to the forefront, and it's very obvious that folks are looking for solutions if they're not already in the process of implementing them.
And just to echo Lana, while the type of acuity may differ globally, depending on where you are and the nature of what ails you, I guess, the world in which we live and the global constraints on supply chain affect everyone. I would say almost equally. It's very difficult at times to get supplies, etc. So for leaders looking for ways to streamline how we achieve that and do that, I think is it's more and more common. And I think that the last couple of years have just made us acutely aware of how important it is, how important your data is, and how important it is to be able to track and see. So, well,
thank you, Christina and Lana, for your time and insights today. Greatly appreciated. I also want to thank our audience for their active participation today. I do have Christina and Lana's contact information if you do have additional questions. Also have up here AIM's contact as well if you'd like to learn more about AIM and some of our initiatives in the AIDC industry as well. Thank you again, everyone, and enjoy the rest of your day.
Thank you, guys. Thank you, Mike, for facilitating.
Yes, thank you.